Introduction to the inaugural edition of MedTech World. Welcome note by Honourable Chris Fearne.
What kicked off as a small side event at the Malta AI and Blockchain Summit in May of last year has now flourished into a full-blown summit with a diverse program spanning regulatory frameworks to wearables, to voice technology and smart implants. All of this in less than a year and a half. Well done. In the past months of the COVID pandemic, MedTech has come to the fore. It experienced an immense growth in areas such as digital health, such as telemedicine, robotics and wearables. In Malta, we also experienced this growth, and now there is really no turning back. In fact, we have kicked off for the very first time a telemedicine center here in Malta under the leadership of the primary healthcare department in Malta, and we've had over 100,000 consultations in less than a few months. In fact, today, when contacting primary care, a voice call is the norm and the video call is the norm rather than the exception. We're also working tirelessly to introduce inpatient prescribing at 𝐂𝐸 Hospital through 𝐉𝐨𝐢𝐬𝐧, our robotic pharmaceutical dispensing machine, and Sophia, the companion software which enables prescribing doctors and nurses at 𝐂𝐸 to take quick, safe and efficient decisions. In fact, we're currently implementing the Sophia system at 𝐂𝐸, supported by the development of 17 robotic dispensing machines across our main hospital. Our vision is to help professional staff, doctors, nurses, pharmacists, to prescribe and dispense the right medicine at the right time, at the right dose, with the potential elimination of human error. In fact, this is not the only robotic system that we have at 𝐂𝐸 Hospital, because we have introduced and are now implementing robotic assisted laparoscopic surgery at the moment for prostate-related operations, but we are looking further to expand this into gynecology, into liver surgery and into ENT surgery. When thinking about MedTech, one cannot help but think about how medical information travels between different healthcare systems. In this past year, in these last few months, we have taken important and challenging decisions to enable digital transformation of healthcare through the implementation of numerous projects, most specifically the electronic patient records. And in primary healthcare, we have done this within a space of a few months. And in fact, what kicked off as the initial program before the pandemic in February has now resulted in the establishment of electronic patient record setups in over 60 healthcare centers across the island. And we already have recorded more than 1 million patient encounters since launching this earlier this year. Public health have also embraced the digital transformation accelerated by the COVID-19 pandemic by developing several technologies in record time, such as COVID-19 Check, which is an app, a system checker app, symptom checker app to assess your risk of having COVID-19. �W𝐞𝐿, which is a World Health Organization outbreak management system used in Malta as well as in other countries across the world, and COVID Alert Malta, which is also another app. In fact, it's Malta's official proximity contact tracing app. In fact, COVID Alert Malta, this contact tracing app, was designed, developed and delivered locally together with the Malta Information Technology Agency in less than 6 months since inception of the project, with a robust information security audit and the legal framework for this app to take place. In fact, within the last few weeks, because this has only been now available for the last few weeks, we have come up to about 15, close to 20% of the population who have downloaded the app. But more importantly, we have placed our code as an open source to allow full transparency in this venture. During the COVID pandemic, we also took the opportunity to switch our staff training online. We've done this by investing into a cloud-based education technology platform combined with an advanced learning management system, a virtual learning environment, and a student management program, all of which are on one platform. We therefore managed to facilitate the implementation of a variety of non-clinical skill courses and even actually enhanced their uptake. We are currently delivering over 50 online courses, reaching hundreds of our healthcare professionals. In the past 7 years, the Government of Malta has also, through the Converge and Mapping Tomorrow EU-funded projects, accelerated the digital transformation in multiple sectors, and we will continue to do this. The summit comes and is happening at the right time and at the right place. The unprecedented growth of MedTech, which has started to take place, and which is taking place despite and possibly because of the challenges of COVID-19, makes this an exciting time. We are looking forward to a future where we can see an increased demand for dynamic critical care models, for enhanced visual and virtual care using connected solutions, and for reinventing the ways that we prepare and that we combat nosocomial infections, including the large threat to public health and to microbial resistance. In the local community, we have noted an increased demand by patients and with patient engagement, and in fact the number of users on our MyHealth digital platform has grown exponentially, and we are now close to 30% of the population which are using this platform. We are truly encouraged by the active and growing digital health ecosystem, powered not just by government but also by a number of active NGOs. And last but not least, we are positive to see the ever-growing educational and research efforts happening at the University of Malta. We are indeed at an important junction, and through the concerted efforts of all relevant stakeholders, including the private industry, Malta can be a MedTech and digital health innovation hub, with its unique character of being English-speaking, of being a member state of the European Union and part of the Commonwealth, and through an active government who is pursuing the vision of introducing MedTech into our healthcare systems. Through this, we can embrace the vision of digital health and MedTech for all and not just for the few. Thank you very much, and I wish you all a fruitful and good conference for the next few days.